Yo, today is a really special case, all right? Going from this to this. We have a beautiful young patient with naturally missing front side teeth, what we call congenitally missing lateral incisors. About 15 years ago, a dental student did their best to place composite filling material to disguise the missing front side teeth. It probably looked pretty good at the time. However, due to the natural deterioration of the composite filling material, it is now time to achieve a better smile for our patient. For this case, there are a few options. 1. Use orthodontic braces and or clear aligners to move the teeth into better positions, okay, so that the missing front side teeth can be restored to the correct proportions. 2. Leave the teeth in their current positions and either restore the missing front side teeth with 2 small bridges or make the upper front teeth wider to ensure there are no gaps between the upper front teeth. Because our patient never had front side teeth, she decided to go with the 2 small bridges while leaving her teeth in their physiological positions. Financial concern also played a role in her decision. So, here is the result, all right? We have adjusted the width of the upper front teeth carefully to allow horizontal space for each of the upper front teeth. Most importantly, we have restored the 2 missing front side teeth, the lateral incisors. Now, there is one more thing that makes this case extra special. I've placed a veneer on a baby molar on the right-hand side. This is because our patient also has a congenitally missing premolar tooth. So the baby molar is still here, right? And now guess what? It's got a veneer on it, yeah? Just like that, all right? Thanks for watching, okay? Thank you to my patient. If you are watching, thank you so much. It was a pleasure to work with you, okay? Please like, subscribe, and follow. Smile Makeover Volume 35 with Dr. Richard.